Thank you for staying tuned to Sunrise at Sea right here on CTV. And we continue the conversation on the Twitter jabs. In the first segment of the Twitter jabs, we were discussing the timeline of the plight of the medical workers, doctors and interns in Uganda. And they went on strike last year in November. However, they later called off their strike after mediations with the government. And to deliberate and give me insight, full insight into this conversation and this situation is Dr. Sam Oledo, and he's the president of the Uganda Medical Association, and he's joining me today. Thank you for joining me, doctor.
You're welcome.
How are you?
I'm great.
Happy New Year.
Happy New Year too.
I just got to find out that you're my brother from the north.
Such a small world.
Such a small world.
Yes.
Thank you for joining me on the show and honoring our invitation. So, we want an update. Everybody on Twitter is asking for an update. So did the government fulfill its pledge and its promise to pay the medical interns and doctors?
Yeah, to our viewers out there on CTV, allow me to greet you. Good morning and Happy New Year. I'm Dr. Oledo Samuel. Yes, it's true. We've gotten great strides from government. As per November's instruction,
yes,
by 23rd of December, we had government fulfill its pledge to the interns, medical interns, and the senior house officers.
Yes.
Those are doctors who are doing masters.
Yes.
And government in that spirit paid the 2.5 million shillings, half of the intended payment for their colleagues who have graduated.
All right.
That's the 5 million shillings.
Yes.
And in that regard, because when we were with the Fountain of Honor, it was agreed that every intern should be paid.
Yes.
As long as he's doing internship.
Yes.
2, every house officer should be paid. And for sure, we are glad that they paid all interns. But now the issue was about the SHOs.
Yes.
Because you find that interns are in these private hospitals. We have SHOs from private universities. That's those who are doing masters in private universities,
yes,
and those who are doing masters in government institutions. So you find that these interns who are paid are actually supervised in the private hospitals where these SHOs are. For example, Zambia Hospital.
Yes.
We have SHOs who are supervising these interns.
Yes.
In addition to the consultants who are actually working there. So you find the SHOs in KA, for example. Yes. You saw the minister saying, Leader Hospital is working. Ginger Hospital is working, Fort Porter is working. Those are in SHOs from Kampala International University.
Yes.
So it is the university which had MOUs with these hospitals, and even KU Teaching Hospital, yes, itself is having, yes, a hospital which is actually supervising interns.
Yes, well, Doctor,
over 20. So what I'm trying to say is, yes, this. Ministry kind of left out the SHOs in private institutions, okay, which is not nice, but we met the Permanent Secretary, Minister of Health, this week, and she actually was so much concerned, yes, very apologetic, assured us that before closure of business this month, the SHOs in private institutions also will be considered. However, this is the however part.
But before you go on, for the benefit of our viewer,
yes,
please say it in full. SHOs. What are SHOs?
I do apologize to our viewers. Yes. Senior house officers.
Thank you.
Those doing masters,
yes, in
different disciplines like general surgery, pediatrics, internal medicine. Those who are adding the second degree. Yes. They've done a first baseline degree, worked, come back for the second degree. So okay, these are the people. However, now we have our colleagues who are doctors in the field. The agreement with the government was, the collective bargaining agreement was, yes, by June, July, the next this financial year, June, July, they are meant to get the 5 million shillings. That is the medical officers. Medical officers special grade going to 8.5, consultants going to 14, and then senior consultants going to 20 million shillings. Yes. However, this is now in the pipeline. Okay. We've met the budget committee. We've met the health committee. We've met Minister of Health officials. We've met also Minister of Finance on this issue. Yes. And we've been assured that there is a specific amount of money, that's 400 billion, yes, which has been set apart specifically to deal with wages. Reason is, health is peculiar in such a time. Not only doctors, but all the health workers. This is going, yes, to be across board. Yes. It's not only doctors. Doctors don't work alone in hospitals. Yes. We work with nurses, we work with clinical officers, pharmacist lab. So this is across the board.
Yes.
The 400 billion is going to be divided across the board.
However, government pledged to do it by June and July of this year. However, your ultimatum gives them until May of this year. So are you going to adjust?
The May bit, the first of May bit
yes.
is, we're in the budget framework right now.
Okay.
So whatever is not put in the budget framework is not going to be implemented in the June, July.
Okay.
Our ultimatum of 1st May was in reflection to the spirit of implementation by the Parliament. And by the way, on the same note, allow me to thank not only the fountain of honor, but also the leader of government business. That is the Prime Minister.
Yes.
She has really been very productive on this issue.
Yes,
she has been. The president keeps saying that this cabinet is a cabinet for fishermen.
Yes.
But for sure, fishermen are proving to be very productive than us who have gone into extra. Maybe because they have this mandate of let's be productive instantly. It has its pros and cons. You get it? But she has really been very productive when she stepped foot in Mityana Hospital. When we talk about this chronic lack of drugs and sundries, we are really so much concerned about omuntu wa wansi. You get it? Going to Mityana Hospital, yes, there was money which was asked for, not by doctors.
Yes.
These requirements were written on paper and given to an attendant. Go and buy sutures, go and buy gauze, go and buy even an anesthetic drug. Go and buy it. But now, of course, giving you a piece of paper, it has to come with quantification. Exactly. What is the outside price of these things put on? And when the Prime Minister went there, she realized that actually this money was not for any of the people. It was to buy these consumables so that they can work on a mother who was sanctioned for seizure. They were last supplied in September last year. You get it? Now, how do you expect a high volume facility like Mityana Hospital, high volume, to have the same supplies which are going to cross over to January? So definitely by December everything was done.
Yes.
And that's why we are very emphatic and saying, no, can we increase the budget from 500 billion of the drugs that was allocated? At least let's add another 250 billion on this. Yes. So that there we know, it's or even the trillion. So that you know, out of the 500 billion, there's an extra 500 billion.
That is going
the population is growing up, but you're still having a stagnation on the money allocated for drugs and sundries. The money bit is not our motivation factor as doctors. No. It is, do I reach the facility and I do what I studied? You get it? Doctors don't want to just go and sit and watch. We are tired of confirming death. We are traumatized. I want to be able to save that life.
True.
But how do I save that life?
If
when
you don't have
drugs,
supplies, equipment,
are not there.
So are there any promises the government has not yet fulfilled? Are the supplies now in the hospital, the drugs, the equipment? Because there were many pictures going viral online with doctors having to, put gloves over their feet, to, walk around the hospital. So has the government fulfilled that as of now?
As of now, government has done a great job in trying to supply these consumables.
Yes.
I think the incidence of Mityana opened the eyes of many government officials that this is the same predicament elsewhere. So there has been increase of supply in the different hospitals. Yes. However, it's not enough. It's not enough. In the same spirit, you find, for example, I was shocked, I was in Mulago about less than 3 days ago. Mere gloves to use. They went out of stock of mere gloves to use. Individuals, doctors, and the health workers are being supplied 2 masks. 2 masks in 2 weeks. That is unthinkable. So people are buying these consumables. The president was very categorically clear. Please, can you quantify what every facility needs at such a time? Yes. Especially on protective gear and what to use. We are losing health workers in this. The over 65 health workers who died, they were never compensated.
They haven't been compensated to this day?
They've never been compensated, no.
Is it in the pipeline that they're going to be compensated?
I think that is the food of thought to the Parliament.
Yes. Because
now our mandate as Uganda Medical Association is to advocate for it, and we are still going to advocate for it. But now, since Parliament is in the budget allocation, can they have this through Ministry of Gender being implemented?
Yes.
Can we have these families compensated because the Workman Compensation Act is clear. 60 months for these families. Doctors, what we know is to treat. Health workers, what we studied is to treat. We've not studied to go and say, for example, hand a business elsewhere and the rest, which probably we might engage later. But as for now, let's have respect for those who have died doing.
Yes.
So now, you find that if you do not supply these things, you're exposing even the few. I'll talk about something very little on COVID. Very little on COVID. COVID causes fibrosis of tissues. Fibrosis is scarring. Like you get a wound and you're left with a scar.
Yes.
So now COVID goes on the epithelial cells. We have body organs which are majorly lined by epithelial cells. The pancreas is there, the kidneys are there, the lungs are there, name it. So at the end of the day, when someone has healed from COVID, because of the inflammatory effect of COVID, not itself as a virus, because it comes and attacks the cells, and the body has to fight back. In the process of fighting back, inflammation is done. So in the process of healing, there is a fibrosis happening. You get it? It's the reason why people who have been predisposed to diabetes, those who are at risk of getting diabetes, being hit by COVID, you find eventually they become newly diagnosed cases of diabetes.
Yes.
Those who already have diabetes, they become complicated. They become decompensated. You get it? Now, you was healed of COVID, the lungs, part of the lung tissues become fibrosed.
Yes.
You get it? So that's why we are saying, even when you're healed, make sure you do 3 things which are key. Look at diet, look at regular exercises, and look at regular checkups. They're important. And in regular checkups we are overemphasizing this. Please, Ugandans, when you identify clinical symptoms of COVID, go and get a medical attention. Let you be reviewed by a doctor. This thing of saying, I feel flu and cough, and then you go over the counter drugs, it is dangerous.
Self-prescription.
Exactly. You find patients, someone comes, you're walking, yes, you have difficulty in breathing, and you feel you're comfortable. You can breathe with difficulty. But at the end of the day, when you reach the hospital and they check your oxygen saturation, you find you're less than 80%. There's what we call euphoria effect.
Yes.
Of the reduced oxygen concentrations of the body. So you find someone who is COVID positive even can survive with oxygen saturation levels up to 80%.
Yes.
But it is very dangerous. You can reach 60 and you collapse. So it is important that you get a medical review.
And doctor, on the same subject of COVID-19, let's talk about mandatory vaccination, where doctors are against it. And yet we have the surge of COVID-19 infections by the day. So why are doctors against it?
We are not against the vaccination itself. We are against the forceful vaccination.
Yes.
We have very many mandates. Doctors, we are trained not to coerce. Medical ethics, we do not force someone to be given a treatment.
Even if it is good for them?
It is not in the mandate unless it is protecting the community. You get it? For example, when it is highly infectious, I'm not meant to hold information of a specific disease which is highly infectious of the community when I've identified it in an individual.
Yes.
But in a scenario where we have vaccination, that's why we have consent forms filled in. The reason of the consent forms is, do you agree to get this? Vaccination is not meant to be a forceful mandate. However, we must do a lot of sensitization.
Yes.
Why are people not taking up? But areas like Kampala, people are actually crying for the vaccines and are not there. Why don't we first clear the high volume areas?
Yes.
Kampala has a population of over 8 million Ugandans
yes.
who are always saturating. So those who are within Kampala who want to be vaccinated, why don't we first clear them up? And our natives, because this message has to be broken down in the most understandable way. You find most of these adverts of COVID, most of these educational backgrounds of COVID, they are purely in English.
Generic, so, and they don't give
So now I'm going
details.
to tell you the medical English. I'm not going to explain to you in your local language. To understand that, please, if you're not vaccinated, when you get COVID, you're going to get complications that are going to lead you into hospitalization. You get it? You're going to get decompensated. You're going to become very ill.
Yes.
Which is true. Now, the vaccine itself helps you to reduce this hospitalization, but it's not a guarantee that you won't get exactly the because you have people who have been vaccinated who have died still. So it's not a guarantee. It's not like when I get vaccinated, it is treatment. No, it is to help us, to protect us, that when we get COVID-19, we have a our immune system has been sensitized.
Yes.
Most of the people in health, all of us who've been vaccinated, have been vaccinated. You get it? But the message that we send to the wananchi is where there's a problem. By the time you're forcing someone to vaccinate them, it means they've not understood. Why don't you make them understand? And you cannot make people to understand. Yes. When the people are meant to educate them, you're not actually giving them the mandate.
Yes.
It is the health workers to go and sensitize the communities. But you find it is the RDCs giving a message about COVID-19 and the pathogenesis. You get it? You find it is the DSOs doing this.
Yes.
The police officers are doing this. And the military. Why have you left out the doctors, the health workers generally? A clinic officer can talk about this well articulated. Same with a nurse. Same with a doctor. Better still, a doctor can emphasize these issues massively. Yes. So now the question of why do you vaccinate and the different fallacies can be answered by the responsible people in the profession.
True.
So we call upon Minister of Health and the stakeholders, the Prime Minister's office, which is in charge of mobilization and sensitization. Can we have engagement of doctors into this, health workers, into this sensitization drive down to the grassroots? Let people understand where we are. COVID is with us. This is not the last wave, I repeat. This is not the last wave of COVID in Uganda. World over.
Doctor, that now starts to sound like a threat.
It is not a threat because COVID is de novo, new disease.
Yes.
So meaning there's a sequel of this normalization in humanity, and we shall reach a time when we don't have very high levels of death. And these strains will keep on going down, the strength keep on going down. If you can see, we came from a very virulent strain, the Delta strain.
Yes.
Now we are in the Omicron, not very dangerous, but can cause catastrophic effects. Yes. You get it? So now, over time, we are going to have this. We can go up to even 7 waves or even 10 waves, but the most heavy waves could be 1, 2, 3, 4.
Yes.
But for us, we need to equip Ugandans. Can we tell Ugandans on how we can prevent this? Especially people in urban areas. Please, you don't have to drive all the time.
On that note of driving, I would like to ask you about the Kampala Express, Kampala Entebbe Express toll-free access, doctor. Why do doctors not want to pay to use the Kampala Express highway? Why? Please clarify that for us, because it was a hot subject on Twitter and has been trending. Why do you want exemption? Why
I started by laughing is because it is a joke in itself, majorly. Because
so was it a joke when you put this forward?
To us as doctors, we ask ourselves one question. How do you expect to use the Entebbe Express Highway when we ask for tax-free vehicles and they're not there? Are we going to use border borders on that road? There are basically few. So that's why we are saying... You
were being cynical in this matter.
No. Let's not go into issues which are really not... Our issue is, can we really have the tax-free vehicles so that a doctor can actually be in the facility at the time needed?
Yes.
Let's have the drugs in the hospitals and the sundries, okay? Because the government is talking about having a medical officer in Health Center 3. You don't have functional theaters.
Yes.
Can we have theaters there? You have over 4,000, you have over 2,000 positions unoccupied for. We have 1,631 doctors employed by government. That is 40% staff gap.
Yes.
So you have 60% staff, that is 40% coverage. 60% staff gap. 3,000 doctors are not employed. Can you believe that? And we have 1,000 doctors not employed by government who are languishing on streets. But we have a gap of 3,000 doctors not employed. Medical officers, special grade, those who have finished masters, there are 311. We need 550. That's the gap left.
Yes.
Consultants, we have only 117. We need over 300 consultants. Okay? We have only 61 senior consultants.
How do we fill that
gap? We need 200. The people are there. The doctors are there. They have studied. So now the question is, why doesn't public service put these adverts? Yes?
Yes.
Put budget for these gaps. Okay? So that in the next financial year, we have employment. The president spoke. The president said, employ all the doctors, because he knew that even if you employ the 1,000 doctors already who are there without doing any work,
yes,
you will not have the coverage of 3,000 doctors. So that's why the director was employ all the doctors.
Yes.
You get it? There are doctors who have stagnated in some positions. Someone is a medical officer, and he went back, did masters. He went back in the same facility. He's working as a medical officer, but he's a consultant. Can you believe that? Someone is a surgeon. He has worked as a surgeon, for example, for over 6 years, but he's at the level of a medical officer.
Yes.
Where are the promotions? So what we are saying is, let's think of the larger picture.
Yes.
If you have, because we are seeing patients traveling from district to another district to look for a specific doctor.
Yes.
And yet, we have these doctors in those regions, but they're not given what to do.
Exactly.
So, and they're not equipped to do the things.
They don't have the vehicles
Exactly.
to move
at the end of the day,
places
the express highway fallacy
yes.
is none of the issue. If you pay doctors well, you've given them cars, I don't think doctors can fail to contribute the 5,000 shillings.
Yes.
You get it? And it is also in a good spirit.
Yes.
We would love also to contribute something to the economy.
So it's not about being exempted.
There's an however to that.
Yes.
Let's have the presidential convoy use that. Let's have the ambulances and fire brigade. Onule. The word is onule.
Yes.
You cannot tell me that you want to exempt the members of parliament. You get it? You cannot tell me, because members of parliament are well facilitated. For sure.
And they can afford that.
They can afford this. If a member of parliament cannot afford 5,000 shillings on the express highway, who in Uganda can?
Yes.
You get it? So this is an area of us to agree on. However, doctors have no vehicles to even cross.
So that is the that is the major problem.
Exactly.
There are no vehicles to even use that road.
Yes.
That
Now,
is why
are we going to use motorcycles?
So lastly, doctor, what other incentives does the Uganda Medical Association have for the government, or would like the government to put in place? Before we came on air, you were talking about a national insurance scheme. So please highlight more on that.
Yes, there is a national health insurance scheme under debate. We as a government, we need to think out of the box for sure, because we know populations are going high.
Yes.
And the biggest challenge is we still have the same resource envelope.
Yes.
Yes, we have ideologies of the oil and the rest. We have not yet harvested. And at the end of the day, we are still depending on the taxes. So at the end of the day, if it is the same taxes which are contributing to drugs, to welfare, and the rest, then we should think out of the box. It is true, we should now have a discussion of the National Health Insurance Scheme, whereby everybody contributes to the National Health Insurance Scheme at their area of maximization. For example, if I'm a farmer, a peasant farmer, that's why you find that even when they get, we have our patients coming from the rural areas, they come to hospitals, and there's a stock out of these things. They end up buying these things. So instead of them buying these things at the time when they're down, why can't we have contribution packages right from the lower level of individuals contributing something, however little, to the National Health Insurance Scheme, and scales upwards? So that we are sure that annually, out of the 48 million Ugandans, if, for example, we have about 30 million Ugandans who are productive, each of them contributing, we have an extra about 300 or 500 billion annually. This can boost, even if it went only on drugs and medical equipment. Because you find there is no hospital in northern Uganda, eastern Uganda with an ICU. We lost a fellow pediatrician whom we were referring from Gulu Regional Referral Hospital to Kampala for ICU management. But we put her in an ambulance. Dr. Grace, may I so rest in eternal peace. A young pediatrician, it takes 10 years to train such a person. 10 years minimum. So we had to pick her from Gulu in an ambulance to oxygen. Even we asked for support from government, UPDF chopper, we couldn't have it. Anyway, that is
a story for another day.
But such individuals being transported from a specific region to another region to get specialized care. So now, if we have this national insurance scheme where everyone contributes to this pool, we are sure that we can have equipments in all the regional referral hospitals and the other regions. We have this, no CT scan in eastern and western and northern, you get it. Central here, they function, the ones in Mulago are dead, Mbarara is dead, So even at the end of the day, we need to discuss further. However, on that note, this is a message to our colleagues, the doctors. Now that government is doing something, can we also as doctors do something for our patients? Yes, we know the staff gap has been much. The work which is meant to be done by 5 doctors is done by 1 doctor.
Yes.
You get it? We understand this pressure. But now, can we have output even for us who are already there?
Yes.
Can we treat our patients? Can we be available for our patients? And as Uganda Medical Association, actually, we are looking into this. We are having different approaches. Please, we are encouraging our doctors. Government is going to give you the 5 million shillings, 8.5, 14 million shillings, 20 million shillings. And also the senior consultants are going to get vehicles.
They're going to get their money, everything they have asked
for the love of Christ, we started to save lives.
Exactly.
Can we also work on Ugandans with the love that even later when we demand and ask for other things, Ugandans also, they're the ones that have to fight for us.
Thank you, Doctor. All right, thank you, Doctor. We can go on and on and on with this conversation. Thank you so much, Dr. Sam, for joining me on the Twitter Jabs right here on Sunrise at Sea. We still have a great show lined up for you. Coming up is our wellness segment. You won't want to miss that. Don't blink.